Hello everyone, I'm Dr. Liu, come from Department of Traditional Chinese Medicine, the first affiliated hospital of China Medical University. This class will learn acupuncture treatment of dysmenorrhea based on the traditional Chinese medicine. This class will learn dysmenorrhea. Now let's begin. This part can be divided into 5 parts: introduction, etiology and pathogenesis, differentiation, treatment, and remarks. Part 1. Introduction. Lower abdominal pain, sometimes associated by pain in the lower back or sacral region, occurring before, after, or at the onset of menstruation, which in some cases is excruciating, is known as dysmenorrhea. It occurs mainly in young females. The disease is classified into primary dysmenorrhea and secondary dysmenorrhea in West medicine. Primary dysmenorrhea due to non-organic changes of productive organs usually happens in a married young female or in nulliporia. The problem will be solved spontaneously after getting married or childbirth. Secondary dysmenorrhea due to organic disturbance in reproductive organs is often seen in such diseases as hypoplasia of uterus, hyperretrovirgin and hyperantivirgin of uterus, stenosis of cervix, endometriosis and pelvic inflammation. Etiology and pathogenesis. The disease can be classified in 2 parts: excessive and deficient C-zones. The disease can be classified in 2 types: excessive and deficient C-zones, each with different causes. The excessive C-zone is ascribable to the exposure to cold or intake of profuse cold drink during the menstruation. The cold makes blood stagnation by its congealing, and the stagnated blood resides in the uterus, retards the menstrual flow, and results in pain. On the second hand, mental depression gives rise to qi stagnation, which impedes the menstrual flow and causes pain. The deficient C-zone is due to constitutional debility and insufficiency of qi and blood after severe or chronic illness, as the sea of blood becomes insufficient and empty, and unable to nourish the whole meridians. Next part, differentiation. Part 1. Excessive C-zone. Main manifestations are lower abdominal pain occurring prior to or during the menstrual period, pain lasting for several hours or even 2 to 3 days. In several cases, pallor complexion, cold sweating, lassitude, cold lumps, or accompanied with nausea, vomiting, diarrhea, headache, and act. In the condition of qi and blood stagnation, there appear distending pain in lower abdominal, which dislike pressure, small quantity of impedic dark, purple bleeding associated with clothes, the discharge of which relieves the pain, distension in costal region and breast, purplish spots on the tongue, thready and watery pulse. Next, in the condition of coagulation of colds and jumps, there appear cold pain in lower abdominal, radiating to the back and being relieved by warmth. Scanty dark menstrual flow associated with cloth. White sticky tongue coating. Diptens pulse. Next one, deficient syndrome. Main manifestations are dull pain appearing in the lower abdomen at the end of or after menstruation, which is relieved by warmth and pressure, scanty light red, and the thin menstrual flow. In the condition of deficiency of qi and blood, there appear pale or shallow complexion, lassitude, dizziness, blurring of vision, palpitation, pale and enlarged tongue with teeth prints on its border. Forceless thready pulse. Next one, in the condition of weakness of liver and kidney, there appear soreness in the low back and knee joints, poor sleep, dizziness, tinnitus, right tongue with little coating, thready pulse. Part 4. Treatment. The first one, basic treatment. To excel syndrome, the method is to promote qi circulation and dispel cold, remove obstruction from carotids. Points of conception vessel and spleen meridian are principally prescribed. The main points conclude 中极、三阴交 and 次疗。中极 serves to regulate qi in cervical vessel and conception vessel. 三阴交 is to remove obstruction from the meridians and the spleen. 次疗 is an empirical point for dysmenorrhea. The location of acupoints have been introduced in previous class and will not be introduced in detail in this lesson. Addition points, 归来 and 地基 are added for cold accumulation and 太冲 for qi obstruction. Combine 天枢 for abdominal distension. 阳陵泉 光明 for chest pain and 内关 for stiffness in the chest. The manipulation as to reduce technique is applied to all points. Moxibustion is combined to cold syndromes. In deficient syndrome, the method is to tonify and regulate qi and blood, warm and nourish cervical vessel and conception vessel. The points from foot tying meridian, foot Yangming meridian, and conception vessel are merely prescribed. The main points conclude 三阴交、足三里 and 气海。三阴交 and 足三里 are beneficial to reinforce spleen and stomach so as to replenish qi and blood. 气海 is performed with moxibustion to warm the lower jaw and to regenerate essence and blood. When qi and blood are sufficient, uterus and clitoris can be nourished and the flow is smooth in cervical vessel and conception vessel, so the dysmenorrhea is eased. Additional points is add 脾腧、胃腧 for qi and blood deficiency. 太溪、肝腧、肾腧 for liver and kidney deficiency. Manipulation is reinforcing technique with filiform needles is applied, and moxibustion can be incorporated. Next part alternative treatment. The first one, ear acupuncture. 2 to 4 ear points are selected in each session into the genitalia, sympathetic, subcortex, endocrine, 肾门, liver, and kidney. Needles are rotated to give moderate and intense stimulation and return for 15 to 20 minutes. Embedding of needles in the points is also applicable. Next one, intratumoral needle therapy. Select 气海, 地基, 三阴交, and ash point, and embed special small needles beneath the skin of the points. Needles are embedded for 2 to 3 days. The last alternative treatment is point injection. 1 kilometer of 2% protein injection is injected subcutaneously into 中极, 关元, and 次髎 once daily. There are various causative factors for dysmenorrhea. Gynecological examination and radical treatment are necessary in order to ensure the diagnosis and therapeutic results. Good personal hygiene during the period is required, and emotional stress should be avoided. Exposure to cold and excessive intake of cold or raw food are prevented.